Do you have symptoms of chronic illness such as pain, inflammation, gut problems, hormone issues, allergies, autoimmune disorders, anxiety, depression, etc.? And no one can give you a clear cause. You go to the doctor, he takes labs, your labs all look fine. You're miserable, but supposedly you're healthy. Listen up, this one's for you. 17 million people in the United States are suffering from some level of mast cell activation, and almost all 17 million of them don't know it. What are mast cells? Mast cells are the white blood cells responsible for releasing mediators into the bloodstream in response to a threat. One of those mediators, histamine, which you've certainly heard of. Mast cells have been involved in disease and our response to chronic disease for forever. Classically, they've been a middleman. You have a root cause, you have a mast cell response, and that creates the symptoms that you can feel. Increasingly, and we're not sure why, they are not just a middleman, they are the cause of complex chronic illness. So your doctor's looking for an illness usually associated with your symptom set. He doesn't find that illness. He sends you home and says, you're fine. When in fact, the mast cells themselves might actually be the problem. Again, 17 million people in the United States alone, and almost all 17 million of them don't know it. Why is this a problem? It's a problem because if your symptoms are being driven by mast cell activation as opposed to some other root cause, then your treatment is often different, sometimes completely opposite to the traditional wisdom used to treat fill in the blank. Super confusing and super frustrating. Let me give you one example. Food sensitivity. The classic wisdom with treating a food sensitivity is isolate the problem, remove the problem food so that it stops creating the irritation. As long as you avoid eating the food, you avoid the symptom. In mast cell activation, if mast cell activation is driving your food sensitivity, then actually removing a food, any food, that makes the problem worse, not better. And here's the reason why. Anything that you don't eat for a significant amount of time, you become more sensitive to rather than less, which means, number one, you'll never be able to reintroduce that food, especially after taking a long break. And number two, your sensitivity to other things will also increase. So yeah, you remove the irritant, you get a short-term gain and a long-term loss because you're just turning the screws on yourself, as it were, and making yourself more sensitive over time, which just means your diet gets harder and harder and harder to maintain. Good nutrition gets harder and harder and harder to maintain. You get sicker, your symptoms get worse, and you have less tools to solve it with. All that to say, if you're struggling with complex chronic illness and nobody can give you a clear reason why, if you feel awful and your labs look fine, and especially if your symptoms or your sensitivities change from day to day, sometimes you're super sensitive to one thing and the next day, not so much. You can tolerate one food one day and the next day, not so much. Then maybe stop and ask yourself, is it just me or might it be my mast cells?